Tell us a little bit about this plan, how this came together. How did the three of you set this up?
Yeah, it's a good question. And I think that certainly Todd and I, Todd Combs in our office,
yeah.
Discussed it quite a bit. Todd is on the board of J.P. Morgan, and I think he talked to Jamie about it, and he participated probably more in the discussion than I did, but I love the idea of tackling what I regard as the major problem of our economy. I think that you had healthcare costs go from 5% of GDP in 1960. They were $170 per person annually, and now they're over 10,000, and they're closing in on 18% of GDP, which is as much as the federal government raises in a year. So it gives every indication of going up and up and up. Now, you want the best health care, but you find that in other industrial countries that were at about our 5% level many years ago, they've gone up into the 11% range or thereabouts. So we have got a huge competitive disadvantage in American businesses, far more important than any tax change in terms of our health care costs. And 3.3 trillion a year now. That's every dollar has a constituency. So when you try to, and it's a very complicated system, but I do think we have the right three partners, and the job now is to get the right CEO, and that's an enormously important job, and we can't afford to make a mistake, and that is our first and most important order of business, and then we go forth.
You all have not put out a lot of details about how this is going to work, but there's been an awful lot of conjecture, and people trying to figure things out. In fact, on the day that you announced this, there was a huge hit to plenty of healthcare stocks across the board, from insurers to the pharmacy benefit managers. And this is not the first time that a group of people has tried to tackle healthcare costs, but this is the first time that the market has had an instantaneous reaction to something like this, probably in no small amount because of the stature of the three of you combined doing this. What's your goal?
Well, the goal is to deliver better care in reality, and also in terms of how the people feel about the care that they're receiving, because that's important too, and to find ways to take cost out of the system while not impairing the quality of what people receive, and that's enormously complicated. There's so many intersecting companies and people. It's not going to be easy, but we're determined. We've got the money. We'll stick with it. You mentioned actually forming a company. We don't necessarily have to form a company. We may form a company and probably will, but it's just a joint effort now, and we will need somebody to head an organization, and there could be a partnership form and different things, but. And our goal is really not just for the three companies. Our goal is something that other people can pick up on, and to stop this really just constant increase, because there are only 100 cents in the dollar, and if you've got 18 cents, which we're approaching, going to healthcare, you've only got 82 cents left.
You mentioned that it's a very complicated system. I know you're not an expert on it, but you've spent a lot of time digging through it, and so have the other people who are working with this, Todd, Jamie, and Jeff, and lots of other people involved underneath. What's your early read on some of these things? Because if you look for margins, there are lots of middlemen and lots of margins.
Yeah, no, I think we've been inundated from people that would like to run this or like to help. Just inundated, and I should emphasize help, and also companies that would like to join, and all of that, but we're not remotely there. But it would be very easy, I think, to go in and shave off 3 or 4% just by negotiating power or certain things. We're looking for something much bigger than that. That can be part of it, but we are hoping to figure out a way that the constant increase as a percentage of GDP can be at least halted, and hopefully that we could find a way where perhaps better care could be delivered even at somewhat lesser cost.
You think the private sector can do it better than the government?
Yeah, I think usually that's the case, and I think that's probably the case in healthcare.
Hey there, thanks for checking out CNBC on YouTube. Be sure to subscribe to stay up to date on all of the day's biggest stories. You can also click on any of the videos around me to watch the latest from CNBC. Thanks for watching.